Welcome to the nutrition portion of our information session. We're going to start off by talking about the complexities of treating obesity. The first and foremost challenge we're going to talk about with treating obesity is the emotional aspect of treating obesity in humans. All humans are emotional eaters, and this is going to be our greatest challenge working with, the one that you may be the most uncomfortable working with me with, but is also, like I said, the most important factor, even outside diet and exercise. Okay, we're going to briefly talk about the psychological challenges of life after surgery. They can be many, some unexpected, body image inconsistencies, the numerous lifestyle changes you have to make, and to quote one of our patients, the worst part about weight loss surgery is I woke up and I was still fat. Because of these many challenges you may face after surgery, we do ask that you seek out support. There's many professional resources, including mental health providers, online forums, and other resources like Tops and Weight Watchers. I do want to caution you about the internet, and please bring in any questions or concerns you have from that knowledge base, because there is often poor information and very negative information out there. MultiCare Rockwood does offer a support group. It is the third Thursday of every month from 6 to 7:30. It is open for family, friends, any surgery type. I highly encourage you come at least once prior to surgery. You'll be in a room with many people who have had surgery, maybe preparing for surgery at different points. It's a wealth of knowledge and a great opportunity for us to learn and share. We're now going to talk about key lifestyle changes to make in preparation for weight loss surgery. This has multiple benefits, including preparation, demonstrating compliance, possible pre-surgical weight loss, and additionally avoiding preoperative weight gain. This is a very important factor which can delay or even cancel surgery. We want to see you at the same weight or lower from your consult weight. We'll now start talking about the key categories of lifestyle changes. I'm going to break these down into stop and minimize or reduce. These changes are going to be overwhelming and possibly numerous, and we want you to start working on them in an incremental manner. We'll start with the stop category. Nicotine cessation. This is required for a minimum of 8 weeks before surgery is even scheduled. So please do not wait until 8 weeks before anticipated surgery. It needs to be done well before that. The reasoning behind this is you are at risk of serious complications after weight loss surgery if you continue or resume to use nicotine afterwards. Another stop category, carbonation. Now, even if this is calorie-free carbonated beverages, carbonation will hurt after weight loss surgery. You have a very tiny, non-stretchy stomach. You can run into issues with not only the pain, but dehydration. If you're attempting to sip a carbonated beverage slowly over time, you will fall behind on fluids. Another key stop category for lifestyle changes, and that is discontinuing drinking your calories. This includes milk, juice, coffee drinks, smoothies. Now, protein supplements can be a useful meal replacement as long as they're low carbohydrate. If you continue to drink your calories after surgery, you can and will regain weight. Our body does not detect liquid calories, and even with a small stomach, you will absorb those calories, hence over-consuming or overshooting your caloric needs. Let's begin talking about the reduction categories. Now, alcohol. We all know that excess alcohol consumption has serious health consequences. You will also find that you will get hit harder or be a cheaper date after surgery, hence running into problematic issues like transfer addiction, where you may start using alcohol as a coping mechanism instead of food. If you are drinking heavily, we will require some degree of cessation, and it could be prolonged based on your current alcohol use. Caffeine is another reduced category. Now, caffeine is not contraindicated long-term after weight loss surgery. However, we want you to avoid it the 2 weeks after to avoid additional dehydration and nausea. When you meet your dietitian at your 2-week post-op, we will cover resuming reasonable caffeine consumption. We also, going back to liquid calories, want you to minimize liquid calories in your caffeinated beverages. Another key category for reductions or lifestyle changes is reducing the consumption of processed carbohydrates. Now, this can be many categories. People often cite bread and pasta as one of those categories. Yes, they are processed, oddly enough though, are very filling after weight loss surgery and can impair your protein intake. The processed carbohydrates I'm referring to are crackers, potato chips, pretzels. We call these slider foods. They will move readily through that tiny pouch or sleeve, simply allowing you to overeat. I tell every single one of our patients, even after a bypass or sleeve, you can sit down and eat a large family-sized bag of potato chips in one setting. You will not feel full, and you will overshoot your caloric needs. Now, a category to improve, of course, is exercise. One caveat to weight loss surgery, it won't make you love exercise. Hopefully, as you get healthier and lose weight and you can move better, you will resume regular exercise. But if you simply hate it, surgery won't make you do that. Now, we often get pigeonholed on exercise and think it's just going to the gym for an hour, running on the treadmill. We recognize that many people come into surgery with physical impairments and they may not be able to do those things. It's important that you find methods of exercise that you can do, that you enjoy, and you can do sustainably. Let's talk briefly about expectations for surgery. Walking away from this presentation, I want you to have realistic expectations for what surgery can and cannot do. You always have to remember surgery is only a tool and it's only as good as you use it. Surgery will not fix ingrained habits, that is work. It will not make you choose healthy foods, that is always work. Surgery won't make you want to exercise. It won't fix depression. We just have to understand these things going in, because surgery is often thought as, like any surgery, a one-stop fix for all the problems, and it is not. If you talk to anybody who's had weight loss surgery, you will learn that it is work, but it's worth it, and once again, only a tool. We'll now begin discussing key behavioral changes. Now, this is structure we're going to provide you to not only help you prepare for surgery, it'll help you be successful afterwards. Some people find that these changes are beneficial enough that they do not need weight loss surgery. Our starting point for key behavioral changes is slowing pace of eating. Most people eat too fast. This also allows us to eat more than our body needs by overriding the stop signal. Our initial goal is 20 to 30 minutes. If you envision the size of a stomach after weight loss surgery, which for a gastric bypass is roughly the size of a golf ball, you can only fit half a cup of food in an entire meal in that small stomach. You can imagine what will happen if you try and put that half a cup into that small stomach in 10 minutes. Our next key change is consistent eating patterns. Most people I find are very inconsistent eaters. They may skip meals, eat erratically. This will not work after weight loss surgery with that small stomach. You need to eat on a schedule, so this often means eating when you are not hungry. Our starting point is the 2-4-2 and the 2-6-2 rule. Eat within 2 hours of waking up, space your meals by roughly 4 to 6 hours, and stop eating 2 hours before bed. For most of us, this means breakfast, lunch, and dinner. This is actually a good pattern for most people. So I would like you establishing those patterns first. Now, after weight loss surgery, we narrow that down to 2-3-2. That means you're eating 5 to 6 small meals separated by roughly 3 hours. When it comes to nutrition, now I could stand here for 5 hours and lecture you, but I won't. Let's keep it very simple. We use a basic term called nutrient combining. When you look at any meal or snack, I want your first thought to be, where's my protein? You need to establish protein as the base of your meal. It is the one macronutrient you cannot go shy on, and it is a high priority after weight loss surgery. Our second priority, of course, is making those secondary healthy food choices. I give people a simple triage. More vegetables, more fruit, more whole grains or natural starches. Okay, we just want to balance our nutrients out and not eat them in isolation. Another key behavior to start practicing now, and this is very important afterwards, is not drinking with your meals. If you look at those small stomachs, you can simply overfill them with fluids if you drink too close to a meal. Thus, you're competing for real estate or taking up space for your food. Secondly, if you drink or sip throughout a meal, you can literally flush the food out of your small stomach. You now have an empty stomach and you can continue to eat. This is one of the key issues after surgery that can allow someone to overeat, giving the impression they have a much bigger stomach than they do. To summarize the key lifestyle and behavioral change goals I've set, our ultimate goal for these is preparation, success, and much easier transition to life after surgery. Lastly, we're going to discuss surgery as a major commitment. Now, you're sitting here listening to this presentation because you have taken the step to committing to better health. You're not here to impress myself, the surgeons, or anyone. You've made this step for your health. As you've heard, there is a lot of changes that have to go into being successful before and after surgery. It is a major commitment. I want everyone to understand that and go back to the expectations slide if you need to. There are some unique challenges to life after surgery. You need to commit to about 8 weeks of texture modification in your diet. This is for your safety, for your healing, to prevent complications. If you can't commit to that portion, I don't recommend surgery at this time. The next is lifelong vitamin mineral supplementation. You simply cannot get enough from your food with the low volume. There is altered absorption of some nutrients, but mostly it's the volume of food. So you will have to take vitamins lifelong. Thankfully, it is not a complicated regimen. It is not super expensive, but you have to commit to doing this lifelong. So in summary, thank you for being here. Once again, this is a commitment to your health. You've made a big step by starting this process. We want to make sure you are mentally and physically prepared for what may come about before and after surgery. So please take this information to heart. And lastly, you'll be hearing from our case manager.
I'm a nurse case manager for our bariatric program. Stacy is our other case manager, and some of you will work with her during our program. Our job is to help guide you through this process from your consultation with the surgeon until you are ready to be scheduled for your operation. You will have requirements that must be met before scheduling surgery. You may have surgeon requirements such as diagnostic testing and pre-surgical weight loss. You will have insurance requirements such as monthly medically supervised visits, psychological evaluation, and other requirements specific to your insurance policy. Lastly, you will have program requirements that include, but not limited to, blood work, cardiac clearance, EKG, and possibly a sleep study. All of your specific requirements must be completed before we can start your preoperative process and surgery date. Your case manager will go over all of your pre-surgical requirements and send you home with your very own bariatric guide to surgery binder. This is what it looks like. You will also have required follow-up visits after your operation that are very important for your success. Many of your medical requirements can be done through your primary care provider. Insurance. Everybody has insurance questions, and we will go over all of your insurance information when you come and see Stacy and I. Everyone will have insurance requirements to meet specifically prior to insurance approval before bariatric surgery. If you have private insurance through your employer or your spouse's employer, please call them now and ask if you have a bariatric benefit. Not all insurances cover bariatric surgery. You may want to ask your insurance company what their list of requirements are and what your financial responsibility will be. Medicare does have a benefit and does have specific requirements, so I don't expect you to call Medicare. We will go over those at your visit. We also have self-pay packages available for you if insurance is not an option. I suggest that you visit MultiCare Rockwood Clinic Bariatric website for further information. We have videos posted there along with frequently asked questions. Remember to contact your insurance to review benefits and out-of-pocket expenses. Also, remember, surgery will not fix your obesity. Surgery is only a tool. You must be prepared to commit to lifelong dietary, physical, and emotional changes. Thank you for choosing us here at MultiCare Rockwood Center for Weight Loss and Advanced Minimally Invasive Surgery and MultiCare Deaconess Hospital on your wellness journey. Thank you.